Well, Doctor, thank you so much for joining us. As always, it's a pleasure to have you on my show. We're talking about an important topic, especially with going back to school. A lot of student athletes out there, but heart disease, it's a number one killer. So tell me a little bit more about this.
Yeah, first of all, thank you, Maggie, for having us. We don't realize, but every 3 days, we have a student athlete who dies because of heart disease. Every 3 days. So it's a big deal. And, the important thing is almost all of these deaths, maybe all of them, are preventable, Maggie.
So, what can we do to make sure that this doesn't happen to our child?
Yeah, the most important thing to do is screen our children who are at the highest risk. So the ones that are at the highest risk, number one, are the ones that have symptoms. So if any parent or child notices that they're having any chest discomfort, shortness of breath, out of proportion to their level of exercise, any dizziness, lightheadedness at all, or any palpitations where they feel like their heart's skipping a beat or fluttering, those are telltale signs that that child needs to be screened further for heart disease. And then if there's any family history, like someone has passed out or died at a younger age, especially with exertion, those kids need to be screened because those are, again, the ones at the highest risk.
And what all goes into a screening when you do this?
The screening is easy. One thing I would tell our student athletes is it's completely painless. Because as a kid, I would worry about pain and shots and needles. None of that is involved. It starts with getting a very thorough history, getting their family history, diving deep into their symptoms. Then we do a very thorough yet focused physical exam. We listen to their heart. We examine their pulses, their blood flow to their legs, and listen to their carotid arteries. And then, if needed, we can do further testing. But at least an electrocardiogram, what we call an EKG, should be done on athletes. A lot of states actually mandate that. And if you have symptoms, it needs to be done. We find stuff so early that we can actually either disqualify them, but our goal is not to disqualify them. Our goal is to enable them to continue their love of sports and athletics, which almost always we're able to do.
Well, I think the best thing is if we have any questions, just to come see you, because it's better safe than sorry. And to get all of this screening, so where can we go for more, doctor?
Yeah, so we see teenagers as well. They can certainly call our office at Modern Heart and Vascular. We have a whole team of physicians, nurse practitioners, and diagnostics to help our teenagers and college students get to full health and continue to love and enjoy sports.
Well, as always, doctor, it was a pleasure to have you. Thanks so much for waking up with us.
Thank you.